Good morning, guys. Today, topic for the video is kind of substandard hair transplant results and repair of such kind of transplant. Kindly do understand the difference between the disastrous transplant, a failure transplant, and substandard transplant. Kindly watch the video until end to understand how did we manage this substandard transplant and repair it with excellent results. What exactly is a disastrous transplant? A disastrous transplant means something like someone has done with having no knowledge of the transplantation, and the outcome will be so disastrous where even donor also damaged and planning is wrong, results also damaged. That is called a disastrous hair transplant. A failure transplant is nothing but this patient probably out of 100 cases, maybe one or two can go fail. We don't know the reasons. We don't know, but maybe a poor growth they would expect. That's because of the body issues. This is called a failure transplant. A kind of a substandard transplant. What does it mean? A substandard transplant means kind of the person supposed to get good results, but because lack of techniques or skill, they would do a transplant and they get kind of a mediocre results or barely adequate density you achieve. So a poor quality results you achieve. That is called a substandard transplantation. Today we are talking about such kind of patient, and kindly watch the video until and to understand how did we manage it, how did we get good results in such patients. Today's video, this patient actually underwent transplant elsewhere with 2000 grafts approximately. If you can notice this, results are poor. That we can say mediocre transplant results are substandard transplant results. Here why I'm saying this is, if you can observe the backside donor, the harvested grafts, the area looks like they harvested more grafts. The harvested grafts and the growth ratio, imagine the implanted in the frontal area where the growth actually not matching. That means more grafts have been harvested, the outcome is not matching to the harvested grafts. And that's the reason I'm just talking about this substandard transplant results. This is one typical type of such mediocre or substandard transplant results. If you can see the growth for the harvested number and barely adequate density they achieved, though they implanted very smaller portion in the front. If you notice in the frontal hairline, both right and left, hardly there is any grafts are grown, barely adequate density they achieved it. Whereas when you see the harvestation, amount of the harvestation done in the backside, looks like more grafts been harvested. These both are not matching. The harvested grafts and the growth both are not matching. I'm not talking about the existing hair fall or the baldness here. The kind of the growth that happened after the shaving, you can see very minimum amount of the hair is grown. This is the reason I'm talking about this patient. I said this patient is a substandard results. Again we harvested 2100 grafts approximately and made a correction of the hairline and gave the density in the mid scalp, and we achieved excellent results. Here the point is, the first transplant, though it is substandard transplant results, what are the hair which is grown from the first transplant did not go waste for us because we reinforced more density. I'm sure what are the hairs grown first session definitely made to achieve more density in this case. So we achieved density because of the we implanted in the best manner, as well as we utilized the first grafts, however they implanted in between we made it. We can observe the hairline and mid scalp density and even management of the donor. All three we balanced it in such a way that it got excellent outcome. So why these substandard results are happens? In a few cases we need to discuss. Usually that's because of lack of good skill in with the surgeon or the clinicians, whatever it is. So lack of good plan. I'm sure this plan was a little good, only they have taken, someone has taken a little higher hairline, but probably skill, harvestation done very well. The quality of the harvested graft, survival rate and implantation probably gone wrong. That's what I'm thinking about in this case. Conclusion of such substandard wire transplant results is it doesn't make any sense if you harvest more grafts if you are not harvesting best grafts. In the sense, here best grafts means not only best picking up the best grafts. Once you pick up, what is the damage level you are going to do to the graft during the harvestation? What is the damage you are going to, what is the trauma you are going to create to the grafts is most important. How meticulously and nicely you harvest is how best you handle the graft, how best you implant it until end. That gives you the best outcome. So that happens with the expert's hand. When if you go to the substandard clinics or maybe amateur doctors or technicians, whoever does these surgeries, with having no knowledge of handling the best way of the tissues, then they would end up in kind of a substandard results. And there are a few cases we can't deny the fact that they don't get results, but this patient, where he's supposed to get the results, but he ended up in having a substandard outcome. That's what the conclusion about this patient. Kindly go with the best surgeons, best clinics who can handle your case with passion. You can definitely get best results.